You stand up from the couch and suddenly the room tilts. You turn your head too fast and feel like everything's spinning. Or maybe it's more subtle, just a persistent feeling that you might lose your footing or that things are slightly fading at the edges. Most people brush it off thinking, maybe I didn't drink enough water, or I got up too fast, or it's probably nothing. And sometimes that's exactly right. But here's what I want you to understand today. Dizziness is one of the most common and misdiagnosed symptoms in all of medicine. And it's your body's early warning sign that something needs attention. By the end of this video, you'll know the 4 different types of dizziness and why getting that distinction right is the key to finding the actual cause, the most common reasons it happens, and the warning signs that mean you need to be evaluated today. I'm Dr. Kabir Haricharan Singh, a physician who is board certified in both family and obesity medicine. And before we get into it, here's a quick disclaimer. Even though I'm a doctor, I'm not your doctor. This is educational information only, not personal medical advice. Always discuss decisions about your health with your own doctor. Okay, here's where most people go wrong, and honestly, it's where a lot of clinicians go wrong too. Dizziness often gets treated like it's one thing. A patient comes in, says they feel dizzy, and the conversation jumps straight to causes and treatment, without first establishing what kind of dizziness they're actually experiencing. But that matters because dizziness isn't just one symptom. It's 4 completely different sensations that just happen to share the same name to describe it. And each one points you towards a different set of causes. So before we talk about anything else, let's talk about the 4 types of dizziness. Type 1, vertigo. This is the classic spinning sensation. Either you feel like you're spinning or the room around you is spinning. It's usually triggered by head movement and almost always comes from the inner ear. When most people say they have vertigo, this is what they mean. But the word often gets used loosely to describe all kinds of dizziness. Type 2 is lightheadedness, sometimes called presyncope. This is the feeling that you're about to pass out. Things go gray at the edges, your vision narrows, and you feel like the floor is coming up to meet you. This is almost always caused by a blood flow problem, specifically not getting enough blood to the brain at that moment. Type 3, imbalance. This one is less about a spinning sensation and more about feeling unsteady on your feet, like you might fall, even when you're standing still. This type of dizziness tends to involve the nerves, muscles, or the brain's coordination system rather than the inner ear. Type 4, nonspecific dizziness. Now, this is the hardest one to pin down because patients often struggle to describe it. It's not spinning, it's not presyncope, and it's clearly not unsteadiness. It's just an unsettling sense that something is off. This type is often linked to anxiety, metabolic imbalances, or medication side effects, and it's extremely common. Now, here's why this framework matters so much. The type of dizziness you're experiencing is the first clue to the diagnosis. When you can describe it precisely and can walk into your doctor's office and say, it's a spinning sensation triggered by turning my head, or I feel like I'm about to faint when I stand up, you've already helped narrow down the causes dramatically. Now, keep those 4 types in mind as we go through the causes. So, why does dizziness happen? Your brain is constantly synthesizing information from 3 sources to understand where your body is in space. Your inner ear, which handles balance, your eyes, which give a visual reference, and blood flow, which delivers the oxygen your brain needs to process all of it. Dizziness happens when one or more of those inputs breaks down, either sending conflicting signals or simply not delivering enough information. Now, let's talk about what actually causes that. Cause number 1, inner ear disorders. This is true vertigo, the spinning type. And there are 3 causes you're most likely to encounter, and these are them. The most common is BPPV, benign paroxysmal positional vertigo. This happens when tiny calcium crystals in your inner ear get dislodged and move into a part of the ear where they don't belong. The result is a brief but intense spinning episode triggered by specific head movements, like rolling over in bed, looking up, or even tilting your head. The good news is that BPPV is very treatable with specific head repositioning maneuvers that a trained clinician can guide you through. The second is vestibular neuritis, an inflammation of the nerve connecting your inner ear to your brain, most often caused by a viral infection. Unlike BPPV, this one tends to cause a more sustained and severe vertigo that can last for days. And the third is Meniere's disease, a chronic inner ear condition caused by abnormal fluid buildup that disrupts both balance and hearing. People with Meniere's typically experience episodes of intense vertigo with ringing in the ears and fluctuating hearing loss. Cause number 2, orthostatic hypotension. This is one of the most overlooked causes of dizziness, and it's behind a huge portion of the cases I see in clinic. Okay, here's what happens. When you change positions, going from lying down to sitting or sitting to standing, your body normally compensates instantly by tightening blood vessels and adjusting heart rate to maintain blood pressure. But when the response is sluggish or insufficient, blood pressure drops temporarily, causing blood flow to the brain to drop and you feel lightheaded. The most common culprits are dehydration, certain medications like blood pressure meds, diuretics, sometimes called water pills, and antidepressants, the natural effects on aging of your vascular system's reflexes, and a condition called autonomic dysfunction, where the nerves that control involuntary functions like heart rate and blood pressure aren't working properly. Think of this one like a faulty thermostat. The system is there, it's just not responding the way it should. If your dizziness consistently happens right when you stand up, then orthostatic hypotension should be high on the list of causes. Cause number 3, cardiovascular causes. These are the ones we really don't want to miss. If your heart isn't pumping effectively, blood can't reach your brain the way it needs to. And dizziness or near fainting is often how these show up. The cardiovascular causes include arrhythmias, abnormal heart rhythms that disrupt how effectively and efficiently the heart moves blood, heart failure, and significant problems with the heart's valves. What makes these particularly important is that dizziness is sometimes the first noticeable symptom of a heart condition that's been developing. If dizziness comes with palpitations, which feel like racing, fluttering, pounding, or a skipping heartbeat, shortness of breath, or chest discomfort, that combination means that you need prompt evaluation. Cause number 4, metabolic and lifestyle causes. These are extremely common, frequently overlooked, and most importantly, very treatable. Dehydration, low blood sugar, anemia, anxiety, and even certain medications can cause a significant number of dizziness presentations. And they're often the last thing people think about because they don't feel dramatic enough to explain how bad the dizziness felt. If your dizziness is the non-specific type and you can't connect it to any particular trigger, then starting with the basics like hydration, blood sugar stability, a medication review is often the most productive first step. Finally, cause number 5. Neurologic causes. These are less common, but they're the ones where timing matters the most. A small but meaningful percentage of dizziness cases, particularly in an emergency setting, are caused by stroke or TIA, a transient ischemic attack, sometimes called a mini stroke. Brain tumors and conditions like multiple sclerosis can also present with dizziness, particularly the imbalance type. The key here is not to panic, because most dizziness is not neurologic and most dizziness is benign. But you should seek immediate medical attention if your dizziness comes with any of the following: chest pain or palpitations, sudden, severe headaches, especially if it wakes you from sleep, if it's the worst headache you've ever had, or is very different than your normal pattern of headaches, weakness or numbness on one side of your body, slurred speech or sudden difficulty finding words, or double vision. That combination of dizziness plus any neurologic symptoms is a potential stroke until proven otherwise. Don't drive yourself, but call 911 and get to an emergency room immediately. Remember, dizziness is a signal. It's your body letting you know that something in the system, your inner ear, your blood pressure, your heart rhythm, blood flow, your metabolism, isn't working the way it should. When you identify the signal correctly and follow it to the source, you get the opportunity to address something real before it becomes something serious. If this video helped you understand something you've been wondering about, please share it with someone who needs to hear it. And leave a comment letting me know what you'd like for me to talk about next, and I'll see you in the next one.